So let's go back to the day-to-day problems that we have in South Africa instead of focusing on the frontline states that were assisting South Africa way back, because we have the issues today that we need to focus on. We are talking about a free healthcare in South Africa that is not free for South African. And I'm talking about a lived experience. I know that healthcare in South Africa for me as a South African is not free, but I know that it is free for certain people and it is free for illegal immigrants that are here in South Africa illegally, and we've been fighting for that for the longest time. I can see that some of the parties are coming into the party because obviously they see that this is a pressing issue and South Africans are not happy about it. When I'm saying South Africans, I don't include anyone who doesn't believe that the influx of immigrants in South Africa have a very negative impact in a lot of the state-owned facilities such as healthcare system. But before we can go back to that, let me say Dumela Kazi, welcome back to the Cafe. If you are new here, welcome. And if you are returning, thank you so much for gracing us with your presence. Before we jump into it, please do make sure you are subscribed, like this video, it helps a lot. And also please do comment down below with your own thoughts. Without wasting any more time, let's get into it. So let me play you a video of a content creator from Kenya, if I'm not mistaken, praising how free the healthcare in South Africa is. And on top of that, he also mentions that the people, the politicians of that country, which is Kenya, they come to South Africa and get healthcare for free, which I am not sure how is that happening if they're coming into the country legally. Because obviously, if you come into the country legally, you have to also produce that you are able to take care of yourself as far as the health is concerned. So that means you have to have a medical insurance, especially if you are a health tourist or you are sick and you have to be in the country. Obviously, you will get the visa for that, which can go as far as 3 months, and you have to have a proof that you are going to afford the medical care in South Africa before they can accept your request of that visa. So he says that even the politicians' children and the politicians comes to South Africa for healthcare, and that is for free. Let's go to him.
Services at the Chris Hani Baragwanath Hospital. This is the largest hospital in Africa, and medical treatment is free. So there's been this claim that county governments cannot manage healthcare, let healthcare go back to the national government. Let me tell you this, what has failed in Kenya is leadership. I just want you to look at this hospital. Look at this hospital. This hospital covers 170 acres. And guess what? It is managed by the county. The county here is like the provincial administration of Gauteng, okay? And this is near Soweto. And this hospital, you come here, you get treated for free. And by the way, children of politicians in Kenya come here to be treated for free instead of building hospitals in Kenya.
So he also further says that the transportation of patients, obviously, if you are sick, you can just get a call and say, you know what, I am sick. Please do come to fetch me if there's an emergency. So the emergency cars or the ambulances will come and pick you up for free. That's what he says. Listen to him.
Look, everything is free, including ambulance service.
So not only that, everything is free in South Africa. The oncologies, the this, the that, the that. I'm not sure if I will play the rest of the video. You get what I'm trying to say. And I'm trying to show you that healthcare in South Africa is selective. Let's start with the healthcare system that he says is free and it is for everybody. Yes, it is for everybody. The illegal immigrants will come and say, you know what, I am so sick and all of those things. And the poor nurses and doctors would say, oh, this poor man and this poor lady, we need to give them our utmost best healthcare system in this country for free. And then I come as a South African, fully South African. Both my parents are South African. are South Africans. Both my parents are South Africans. I had to repeat it. And I had to pay over 6,000 rands to actually take care of my oral problems. So I have a medical aid. So the medical aid that I have is just a basic medical aid because I'm still young and I don't really have any issues, but I had to do it for like my teeth problems if I have, and all of those things. Like you can go like your basic GP if you've got a cold or flu or whatever. So I got myself that because medical aid is expensive and I'm not willing to pay hefty amounts of medical aid at my age, and I'm not using it for the common things that are very expensive unless I get to the point whereby I see that I need a more expensive medical aid. Probably I can afford it, and I do have problems that I need to take care of with the medical aid. So I went to my private dentist, obviously, and then obviously I had the impacted wisdom tooth. I had impacted wisdom tooth both sides. So I had to remove two of my bottom teeth and the one on top, and on this side as well, the same thing. And I had to pay over 6,000 rands, including my consultations as well, and all of those things. Yes, I do pay on my private side, the private dentist. I do go there with my medical aid. Obviously, they take something from my medical aid. I don't pay in cash, but it's a medical aid that I'm paying it in every month, obviously. So I do pay it in cash. So, but obviously I thought that I am in Tygerberg, which is a state-owned university hospital, but no, I get charged for it. And I'm not really mad about it because yes, I can afford it because of the medical aid, and there are people who really need them. But my problem here is the people who are coming into this country illegally, they get that for free, because when you get to the hospital, they actually they actually check if you do have the medical aid without you telling them that you do have a medical aid, because I did not sign in that I had a medical aid at Tygerberg. And all of a sudden my medical aid is getting charged. Luckily, obviously, they do get the money, because obviously my medical aid, it does pay for that amount, and I went to the right state-owned hospital. That was the advice that I got from my dentist. But I was never told that I'm going to be charged because it's a state hospital. And you know what? One day, the first day that I was going to the hospital, I was sitting next to the guy who is an immigrant, and he was asked if he is able to pay for this whole procedure that he's gonna do, and he said no. Okay, they say okay, cool, it's okay, it is fully funded by state and all of those things. And to my shock, when I check my statements for my medical aid, I got charged twice now, because I just went for my last session and I got charged. I thought I was not gonna charge for the second time, but I got charged. So there is no free healthcare in South Africa. There is no free healthcare in South Africa for people like me in the country, in my country, my own country, where I was born, where my whole lineage and my whole everything is here. I got charged, but success from wherever, they don't get charged. They get free healthcare in South Africa. And you think that we are not fighting, we just hate. We just hate at our African brothers and sisters, as a lot of people are saying, that the EFF goons and everybody who thinks that they are more clever than the people who are on the ground fighting for these influx of illegal immigrants in the country. We are getting charged in our country, and you are helping it. As a South African, who are saying that we are hateful when we are saying that there's a problem with immigrants or illegal immigrants coming into this country and getting free healthcare, that we as South Africans, and I'm talking about me now, and me as a South African, I'm not getting that free healthcare. As you can see on the paper, on everything that I showed you, it says that I'm getting charged, and I'm getting charged for also a consultation fee. What the hell is that? Why am I getting charged a consultation fee, but Success, from the other hand, they don't get charged a consultation fee? You asking yourself. Let's move forward to the last point that I want to make here. You're talking about ambulances that are free. Yes, the ambulances are free. They are fetching people. I probably would get charged if the state ambulance would actually come and fetch me. Fortunately, I have a medical aid. I can go to a private hospital. So I will be fetched by ER24 or whoever, go straight to the private hospital. So I know I'm going to be charged. But let's say I am getting fetched by the government vehicle. I probably going to get charged. I am going to get charged, and someone in the in Danune or something from wherever place they came from, they are illegal immigrants. They're getting fetched and for free. And at that time, someone who is a South African is dying. They're dying. Like, they need that car, but because of the influx, they don't have enough cars. There are not enough cars. I can tell you, in the villages, in the deep down villages, there are no ambulances going and fetching people. There are no ambulances going and fetching people. They are either broken or something is just wrong with them, and no one is coming to save them. They have to save themselves. They have to go and ask a neighbor to take them to the hospital. That's what is happening. That is what is happening. That's why we say Dudula, PA, Action SA, whoever is trying to fight the influx of the immigrants in the country, illegal immigrants in the country, whoever is doing that, that's why on this channel I'm saying do it with grace. Do it every day. Do it every single second. Do it anytime. It is helping us as a country. We cannot have a country that says they're giving us this, but we have to share it with whoever. And the people from this country, they are suffering more than the people that came from wherever they came from. It doesn't work like that. But anyway, let me know what you think about this whole thing. Comment down below with your own thoughts. Like this video. It helps a lot. Subscribe if you're not subscribed. I'll see you on my next upload. Peace.